Welcome to our Wednesday morning live. Our first question that we got sent through to us last week was why do our doctors always say different things? And Steph is also going to talk about stress in pregnancy and irritable babies. Was it?
A little bit about that and what to do, simple things you can do to reduce stress in pregnancy to help you and your bub.
Yay! All right.
Alrighty, so we got a question last week from one of our lovely followers, thank you for sending this through, about how or why do you get lots of information from your doctors? Now, we're taking this to mean all healthcare providers, but this person might have meant, more specifically your antenatal providers, your obstetricians, your GPs, that sort of thing. So why do you get lots of different information from doctors? It's a really broad question, but I guess it could speak to, your different doctors have lots of different backgrounds, different education and different specialties. And this is one of the tricky things about, health in general and healthcare these days is there's so much knowledge out there and there's constantly new information coming through. There's lots of incredible research being done. And people have gone to different schools and they have different backgrounds and different interests and they do different research themselves. So as well, your personal situation can really influence what doctors are telling you and the information that kind of comes to their mind to give you. So Beck's going to talk a bit more to that. So when a doctor's giving you different information from maybe your previous doctor before, there's a few things you can do. If it doesn't sit right with you, you can go and get another opinion. There's no law saying that you need to stick with one opinion. If it doesn't sit right, go and get some more knowledge. You can also do some research yourself. So there's heaps of information at our fingertips these days. There's PubMed, which is the actual peer-reviewed research website. So you can type that into Google, PubMed, or just do a quick Google search. But a caveat with that is make sure that the information comes from a trusted source. Don't forget that your doctors have gone to university and they have years of education behind them. And the value in that is when you go to uni and you do a science degree, a medical degree, a healthcare profession, you are layering your knowledge upon knowledge upon knowledge. So you start with your basic sciences and then you go into your specifics. And there's no substitute for having that layered knowledge. So, however, there's also no substitute for up-to-date research. So make sure that you really trust the person you're getting your information from. And if you don't trust it, go and get a different answer or, go and do your own research and look into it.
Like, how do you feel? Like, when they're telling you these things, you're like, I'm really not sure about that. Then, go get your second opinion. Sure. Yeah. How do you feel?
How about your experience in pregnancy?
So I went private the first time and public the second time. So just as an example, with the first, I wasn't weighed or anything like that. My doctor was like, no, you look fine. The baby looks fine. All the scans are great. I thought, okay, no worries. And he knew I had a bit of a background in, fitness and nutrition and stuff like that. And he's obviously trusted me. So he knew me. And then the second time, with the midwives, I was basically getting all the same tests every time I was going in for my antenatal appointments. I was getting weighed every single time. I was like, oh, okay. Well, I was never weighed pretty much throughout my whole first pregnancy, but all the scans, everything looked fine, but that's also what they wanted to do. I was like, okay, any extra test, I'll do it if that's, the regular thing. So yeah, it just really depends on the individual as well. Yeah.
So both pros and cons to, the doctor giving you different information each time. Maybe you didn't need all that extra stuff the first time. Yeah. Maybe they wanted to do some more checks the second time, but you trusted your providers, right? And that sat right with you.
Absolutely.
So
and I felt
happy with that.
I was happy with that. Yeah, absolutely. I didn't feel uncomfortable or I wasn't sure about something. And if I was, I'd always ask questions, or if I didn't feel right about something, I was always asking questions.
Yeah, and that's a great
Don't
point.
hold back. It does
ask
nothing.
Questions.
No silly questions. Always ask. Yeah.
And if you want to see the research, if you want to see why they're telling you something, ask for it. I'm always sending my patients research, and if I don't know, I'll either find the answer or I'll send them to someone who does know. So there's absolutely no harm in asking. Ask questions. It's your body, it's your baby. Yeah. It's really important.
Yeah, exactly. Well, you have the best experience, so get the knowledge and choose wisely.
So on to stress in pregnancy, which stress is a topic that I absolutely love to talk about.
This is her space.
It's so important. Stress in the nervous system is incredibly important. So a patient yesterday asked me about stress and irritable baby syndrome and if there's a connection there. And my answer was yes, there's some research indicating that stress in pregnancy can make it more likely to have an irritable baby, which is essentially crying baby syndrome, or some people call it colic, although that's not the up-to-date what's the word? Label title.
Yeah.
Yeah, sorry, it's early in the morning. You know what I mean? Anyway, so sometimes the thing is we can do something about it. So if you're stressed in pregnancy, there's always something you can do about it. Now, one of the biggest things is to remove the stressor, so the thing that is stressing you out. Now, that's the biggest thing, but that's also often the thing that's not possible. So if the thing that's stressing you out is work and you can't avoid work, there's nothing you can do about that. If it's a family member stressing you out, you often can't avoid them completely, but you know you can minimise contact potentially.
Yeah. Or if you're at work, you could probably sit down and meditate for like at lunchtime or in your breaks, breathing, and which we'll talk about. So that's perfect. That leads on to the next point. If you can't avoid the stressor, there are things that you can do to calm down your body. And remembering, it's about you and your stress, but it's also about your baby. So the more you can keep your nervous system nice and calm, stay in that nice parasympathetic mode, keep everything calm and zen, or as close to as possible, the healthier your body will be. So meditation is really, really great, and it's something that you can do wherever you are, at any point, to help calm your body down. Deep breathing, diaphragm breathing, which we have some links on. I think we've got some videos somewhere. We'll put something up on our YouTube about diaphragm breathing. You've always got control of your breath. So even if you're in a stressful situation, just come back to the breath. Deep diaphragm breathing makes your body feel safe and calms down that nervous system response. Resting. Something as simple as rest. So if you can't avoid the stressful situation, make sure that outside of that situation, you're getting adequate, good rest. So going to bed earlier, getting some help to look after other kids so that you can get some good downtime. Decommitting on your weekends, you know, making sure that you have a good downtime to rest and make sure you're having that balance between maybe some stress and some stressful situations, but having time to really calm your body down. Exercise as well. Yeah, absolutely. Exercise, breathing. It doesn't have to be an intense workout or anything like that. It'd just be some mobility, same thing, breathing, some basic stretching, 20 to 30 minutes a day, because especially when you're going to be feeding a lot, you know, you're tired and you're sore, and you just sometimes just a nice mobilising session, which we'll upload as well. You can do daily too, which is really nice.
So there you go. Even if you are stressed in pregnancy or you have things that you can't avoid, just know that it can. The research shows that it can have effects on the neurodevelopment of bub. So the more that we can reduce that, the better. Alrighty, that's it for Wednesday Live. We've covered a
lot.
Yeah, we've covered a lot today. Hope you've learned a bit from it, and make sure to send in your questions for next week.
Yay, sounds good. Have a good day, everyone.
Have a good day.
Yeah, bye.